Hi, this is Dr. Rashmi Yogish, consultant fertility expert, Khushi Fertility IVF Center, Bangalore. Erectile dysfunction is inability to sustain an erect male organ for intercourse and is a very common condition that is prevalent in today's generation and is less spoken about. It is said that about 8% of men between the age 20 to 29, 11 to 15% of men between the age of 30 to 35, and more than 25% of men over the age of 35 experience some difficulty with respect to erection. The erectile dysfunction could be a temporary phenomenon which can happen either because of anxiety, marital conflicts, or it can also be due to a short span of ill health. However, most of the times we see that erectile dysfunction becomes a chronic thing, especially when there are associated conditions like diabetes mellitus or atherosclerosis or thickening of the blood vessels. Erectile dysfunction is a very common thing observed in men who consume a lot of alcohol or smoke or overeat and have very less physical activity. Lifestyle modification surely helps them. However, when it comes to erectile dysfunction, most of the times with proper modification in lifestyle, exercising, eating right, and staying fit and healthy helps. In some people, when things don't work with any of these things, including counseling, there are other ways like using something called as a penile pump, a suction device to create increased blood supply to the male organ. The second is to use urethral implants, penile implants, and however, some of them will have to resort to using drugs that help them to sustain an erection. However, when erectile dysfunction becomes an obstacle to pregnancy, we would advise something called as intrauterine insemination to increase the chances of pregnancy. We at Khushi Fertility and IVF Center are also exploring the option of using a novel method to address this global issue of erectile dysfunction, less spoken about but very prevalent. We are trying to use something called as a capsule insemination, where the husband gives his semen sample in the laboratory. The semen processing happens and a fraction of sperms that are motile and free of all impurities, especially pus, debris and immotile sperms is prepared. This concentrate usually amounts to about 0.5 to 0.6 ml. The reproductive biologists would provide this processed semen sample in the form of a capsule to the fertility specialist, who would just insert it in the posterior fornix of the vagina, and this would ensure women conceive naturally without having to go through painful procedures where catheters are inserted into the uterus. This would be a very novel method and a very effective method to achieve pregnancy, especially when men have the issue of erectile dysfunction. One has to be very, very positive towards achieving a pregnancy when there is only an issue with erectile dysfunction, as there are several methods, including the one that I spoke to you about, to make pregnancy a possibility.